You know, one thing I remind myself all the time of is that social media, and especially Twitter, is not real life. These platforms are a microcosm that sometimes bring out the absolute worst in humanity. There is no nuance to the conversation. There's accusations flying around. Everyone is evil. Everyone is wrong. Everyone is bad. It's awful. It is awful. Do not spend, listen folks, I know we're at home, and for some of you there's really not a whole heck of a lot to do except watch Netflix or play on Twitter or Facebook or YouTube or any of these things, but please just remember as you're doing it that this is not real life. This is the internet. This is fantasy land. Okay? And the reason I bring that up is because one of the things that drives me crazy about social media is the absolute lack of any sort of nuanced conversation. So, for example, there seems to be this idea among people that are out there wearing their masks and you know, being all gloved up and maybe wearing coveralls like Naomi Campbell. There seemed to be this idea that if you are not doing all of these things and aren't constantly living in fear of getting the virus, then you aren't taking it seriously. In fact, I posted on Twitter just last night that no, I'm not wearing a mask when on the rare circumstance when I go out in public. I've been posting about this for a while. I simply don't believe it's necessary for where I am or to keep me healthy. I think I'm socially distancing, I'm washing my hands a lot, I don't touch my face. I've been trained through my knitting not to touch my face, in an inadvertent benefit. And of course, I got lambasted by all these people who said, you just don't care about other people. Oh my God. Come on, that's not true. But the other time I've seen this happening quite a bit is when people are out protesting, complaining about some of the government overreach. Michigan, I'm looking at you. Or if they say that they're really concerned about the economy and people not having jobs and the impact of that on people's overall health and well-being, they get made fun of. And I kind of find myself in line with this image that I've seen posted by basically everyone I know, that essentially says that you can take all of these things seriously. You can take all of these things seriously all at once. You can both take the virus seriously and do what you can to prevent yourself from getting it or from spreading it to other people. If you happen to have it, you can take that seriously. You can also be worried about our civil liberties being trampled on in the course of this experiment in socialism. And additionally, you can worry about the people, what is it now, like 22 million people who are out of a job because of all of this. You can also simultaneously worry about the health and well-being of those people. And that is what I have really been thinking an awful lot about. Listen, man, I'm an organizational psychologist. I live in the land of businesses. It is where my career playground is. And there are an awful lot of people out there right now that are losing their jobs, having to take pay cuts, don't know how they're going to be able to support their families, don't know how they're going to be able to pay their mortgage, don't know if their job is ever going to come back. And it happened out of nowhere, with no warning. This was not something that we saw coming. And it absolutely is having an impact on the very real lives of very real people. And we're going to talk about that in the course of this video and why I'm concerned about it and why, frankly, those people that are shouting and screeching that we should only be worried about the virus, like, why they're wrong. Why they're blatantly wrong. But before we dig into that, listen, I gotta do my thing where I blatantly pimp the channel a little bit because I really want to see it grow. It's grown pretty quickly and I'm really excited about that, but I want to see it continue to grow and continue to cultivate it and to see what we can all make of it together. So if you like my content, if you like what I'm putting out, please subscribe to the channel, hit the notifications, give it a thumbs up, share the video if you think your friends or family members would be interested. It really helps me out. Now, if you think you are subscribed, go ahead and just do a double check for me. And listen, I know that when I say just double check to make you're sure you're subscribed, sometimes you guys don't listen to me, but let's follow the example of Lewis here, who posted on a video I did a couple days ago, and he said, what the? That's weird. I've been subscribed to your channel for about a month, but when I double checked, like you said, sure enough, I was no longer subscribed. I can confirm that I was subscribed to your channel and I never unsubscribed. I've heard about that sort of thing happening before, but it's never happened to any of my subscriptions. At least not that I've noticed. YouTube is really up to some shady business. Lewis, I completely agree with you. They are definitely up to some shady business. So better safe than sorry. Just make sure you double check. And listen, if I haven't convinced you to subscribe yet, it's cool, man. We can still talk about this story and this idea together, and maybe I'll convince you in the course of the video. All right, so I want to talk about, listen, one of the reasons that I have been so concerned about the economy in the course of all this, and I used to get, man, even before all this happened, I took such rounds of crap for saying the economy is important. I remember when I was tweeting the State of the Union a couple months back, and I believe it was before my article got published, so it was before I ever went to a Trump rally. I was not on Team Trump at all then, but I was tweeting his State of the Union, and I said, listen, I'm pretty happy that unemployment is low. Low unemployment means people have jobs. Organizational psychologist, folks, I'm a big fan of people having jobs. I think it's good. It gives them purpose, it gives them focus, it can give them a sense of pride. There is so much that a job can benefit a human being besides the paycheck that they take home with them at the end of the day. And when I tweeted about that, I got all this backlash like, Carlin, how dare you say that? You're supposed to hate him. He can't do anything good. And I was like, okay, whatever. I'm still going to be happy that people have jobs. Now, one of the reasons that I've been thinking about this so much is that, remember back about, what was it, a little like 10 years ago when we had that little thing called the recession in which a lot of people lost their jobs? Well, guess what happened? Suicide rates went up during the Great Recession. So this is a story from NPR back in June 2014. Let's see what they had to say. When trying to tease out the painful effects of the Great Recession, economists often point to the unemployment rate. The global economic crisis, which first took hold in 2007, left thousands of jobless and financially insecure. But unemployment numbers don't tell the whole story. The recession may also have taken a toll on public health. In at least one particularly dramatic way, researchers suggest in a study published online Wednesday. Suicide rates in Europe and North America rose significantly during those years of financial turmoil, these scientists say. And interestingly, some countries seem to fare better than others. Before the recession, the suicide rate in Europe was falling, but it rose by 6.5% in 2009 and remained at that level through 2011. In the United States, where the suicide rate had a upward curve before the recession, the rate rose more sharply during the recession years. Ultimately, according to the report, which appeared in the British Journal of Psychiatry, North America and Europe together experienced roughly 10,000 more suicides during the severe downturn than the trend from earlier years predicted. So I tweeted this out, I think last week sometime, and the question I have for people who keep saying, we shouldn't be worrying about the economy, we shouldn't be worrying about the economy, it's about the virus, people are dying, don't you understand? For those people, the question that I have is, how many suicides are acceptable? I honestly want a number. How many suicides are acceptable in the course of what we're doing? It is a balancing act, to be sure. It is a balancing act. I don't envy Donald Trump at all in the course of this scenario. He's got a really tough decision to make, and I believe that the plan that they put in last week, the 3-phase plan, is very clear. It's dependent on where you are. I think it's easy to understand. I think it's probably the best case scenario that they could have come up with to reopen the economy. I have tremendous respect for how strategic they're going about that. But again, this is a balancing act. When does the cure become worse than the virus? How many suicides due to unemployment are acceptable to you? Let's keep reading. There are a couple more things. More research revealed how the deaths could have been prevented, and this is from a sociologist they interviewed for this article. I think there could be a number of potential ways in which unemployment could impact a person's mental health. It can cause stress, anxiety, and depression, which in turn can trigger suicidal thoughts. And then this part I just found amusing because this is like This is like the precursor to all the social justice nonsense that we're dealing with now. This sociologist goes on to say, most of those who took their own lives were middle-aged or older men. In some cases, he says, could be unemployment affected the man's sense of identity and masculinity. Encouraging some people to rethink gender norms and expectations could help reduce this sort of pressure. Come on. Man, this guy's a sociologist. I'm going to veto his opinion on that one. What a wonderful precursor to the social justice insanity that we have to deal with today. But listen, this is not funny. As much as I find that particular line amusing, this is not funny. Suicide due to unemployment and the stress, anxiety, and depression that can cause is a very real thing that is going to be impacting very, very real people. But this isn't the only way that this is impacting people. Let's look at this article from ABC News. Calls to U.S. helpline jump 891% as the White House is warned of mental health crisis. This was on April 7th, so a couple weeks ago. The national hotline providing emergency help to people suffering from emotional distress has received nearly 9 times more calls than it did this time last year, with tens of thousands of Americans reaching out for assistance amidst the coronavirus crisis, according to U.S. officials. Federal officials on the front lines of the U.S. government's pandemic response have privately warned members of the White House and Department of Homeland Security that many more Americans will find themselves in dire straits over the coming weeks. And remember, this was written about 2 weeks ago. And that the U.S. agencies had yet to properly prepare for the unfolding mental health crisis. I am very concerned, said one official. Last month, the Disaster Distress Helpline at the Substance Abuse and Mental Health Services Administration saw an 891% increase in call volume over March 2019, according to a spokesperson for the agency. In fact, this March, ending a little bit more than a week ago when this was written, saw 338% more calls to the helpline than in the month before, when the deadly virus began to take hold in the U.S. homeland and government officials began taking more extreme measures to stop it. The agency spokesperson would not offer specific total figures, but the U.S. official said that last month the agency received more than 22,000 calls and text messages for help. But that's not all. Let's look at this article. This article is from The Guardian. Domestic abuse killings more than double amid COVID-19 lockdown. Pioneering project identifies at least 16 suspected incidences in the UK over a 3-week period. At least 16 suspected domestic abuse killings in the UK have been identified by campaigners since the COVID-19 lockdown restrictions were imposed, far higher than the average rate for the time of the year. A pioneering project that records the killings of women by men in the UK has identified at least 16 killings between the 23rd of March and the 12th of April, including those of children. Folks. Her findings for 2020, which were collected from internet searches and people contacting over social media, were raised during the Evidence to Home Affairs Select Committee on Wednesday. So essentially, this is saying that domestic abuse killings are up because of this crisis. These things are not things to joke about. These things are things that we should absolutely be taking seriously, and you have to find a way to balance the impact, again, of this economic shutdown, of quarantining people into their houses, with the impacts of doing those things. And you know, people are starting to have enough. They're starting to have enough, and they're starting to go out and protest. So this protest happened last week in Michigan, and I'm showing you this specifically instead of like an article about it. This is the post I made on Facebook at the time because I started seeing images of the Michigan protest come up on Twitter, and it started trending on Twitter at one point. And of course, what were they showing on Twitter? They were showing the handful of people that had gotten out of their cars and were milling about the state house and not socially distancing, distancing and not doing things safely. And, you know, some people were waving flags that maybe they shouldn't have been or should have thought better of. And they used that as evidence that this is a small protest and all these people are just stupid. Well, it wasn't a small protest. It was not. Look at some of these pictures of this protest. This is posted by Michigan House Republicans of this protest of people in their cars. They're socially distancing. They're staying safe. But look at all these images of just cars look at that one, for miles and miles and miles. This, like, people are getting sick of this. They're having enough with these restrictions. And frankly, I don't disagree with them. Listen, I didn't go out. There was a protest in New Hampshire yesterday. I didn't go out and participate in it because frankly I didn't feel like driving up to Concord was the real story. It's about half hour, 40 minutes away from me. I was like, eh. But also, like, I'm taking this seriously. I'm socially distancing. I'm keeping myself home as much as I possibly can. I very rarely leave the house. You know, rag on me for not wanting to wear a mask when I leave the house, if you will. But I'm taking this pretty seriously, and I don't want to be messing around outside in a protest right now. But I completely understand and support what people are doing. They want to get back to work. And now we're seeing this thing, and I just saw this on CNN earlier today, of healthcare workers are now protesting the protesters because they're saying you're not taking this seriously and doing these typical things. And look, so these people are protesting in their cars, they have their signs, and these healthcare workers are standing in front of their cars looking stern and sinister, and like they know, like, how dare you leave your house and be in your car when we're working to save your life, and all this nonsense. Oh my god, there's so many. You know what really disgusts me is, like, it seems like there's no sort of gray area for nurses on Twitter right now. Nurses on Twitter are either being like, yeah, you don't really need your mask, just socially distance and you'll be fine, and this is all a little bit nuts, and you know, our hospitals don't actually have that many patients in them and things like that. Or nurses are saying, like, don't you dare ask for our help in treating you if you're going to go outside. There is no gray area between the two. And listen, we don't know for sure that these are actual healthcare workers, but let's just assume that they are. Let's just assume that they are. Why are they outside protesting? Why do they have time to protest if they're so busy treating all these cases? Why? And listen, man, because the reality is that hospitals who, like, we're supposed to be doing all this stuff, right? Because we're supposed to not be overwhelming the healthcare system. That's supposed to be the goal, right? We were all supposed to stay home so we didn't overwhelm the healthcare system. We didn't go in, you know, unnecessarily. We made sure that there were ventilators for people who needed them and all this stuff. That was supposed to be the point, or so I thought. Well, let's take a look at what's going on at the hospitals where I live in New Hampshire. Let's take a look from the New Hampshire Union Leader. Lakes Region Hospitals to furlough more than 600 employees. Joan Woodmere, Executive Director of the New Hampshire Nurses Association, says it is not uncommon for hospitals to ask staff to take time off when there are fewer patients. Nurses might be asked to take some paid time off. Right now, with the suspension of non-urgent procedures, the hospitals aren't full. It puts the hospital in a challenging position because they're foregoing patient admissions. They laid off over 600 600 employees, but they're not the only one. The Elliott and sister hospitals announced furloughs, pay cuts of 20% for the workforce. Plans to furlough 650 employees and cut the pay or hours of another 750 will affect nearly 20% of the workforce of Solution Health, which includes the Elliott Hospital and Southern New Hampshire Health. These are big hospital systems in the state of New Hampshire. And they're laying off people too. But this one is actually my favorite. This was my favorite article. COVID-19 idles 700 staffers at Catholic Medical Center. Catholic Medical Center is one of the biggest hospitals in at least central New Hampshire, if not the whole state. It's a big hospital in one of the more populated areas. Brings new hires to Hannaford's. Okay, so we're laying off people from the hospital, but they can go get jobs at the supermarket at Hannaford's. Well, Hannaford's hired hundreds of New Hampshire workers over the past month. About 700 staffers at Catholic Medical Center are sidelined as Manchester Hospital canceled elective surgeries to focus on COVID-19. So here's my question again. Why are we staying completely shut down if the hospitals aren't full? If the hospitals are laying off literally hundreds and hundreds of people? Why are we still staying shut down when hospital workers have time to go out and stand in front of people who are being safe and responsible in their cars? Why, like, you want to say that people like me aren't taking this seriously? You're not taking this seriously. Why aren't you at work? For crying out loud. Listen, again, I'm going to say this one more. I'm going to beat this dead horse. I believe everyone should be taking this virus seriously. I believe everyone should be doing what they can to stay at home when they can, socially distance, wash your damn hands, sanitize your hands, don't touch your face, all these things. I believe all those things are true. And at the same time, we can actually pay attention to the fact that this is going to cause more suicides. This is causing people to call into helplines. This is going to cause more domestic abuse cases. The ramifications of this, besides people who are directly suffering from the virus, are very far-reaching. And there is absolutely nothing wrong with being concerned about multiple things at once. Stop vilifying people because they're concerned about the government cracking down on their civil liberties. Stop vilifying people because they're saying, I'm worried about the mental and emotional health impact that this is going to have on me, on my friends, on my family, on my community. These things are absolutely just as critical to think about as the virus itself. Listen, I'm not smart enough to say that I know when the cure becomes worse than the virus. I have no idea. I really, really don't. But I'm getting concerned that the longer this goes on, the more very real human cost we're going to have. And that has nothing to do with how many people do or do not have the virus. All right, listen, folks, if you made it this far, thank you so much for making it this far in the video. Now, a couple little bonus things right at the end for people who made it this far. First off, some of you have asked me to show off more of my knitting, and so this is a shawl that I knit. This is my Fire Fade shawl. I'll actually show you a full picture of it. This is actually the Find Your Fade shawl by Andrea Mowry. It's a super fun knit. I've actually knit a couple of these. This one is my favorite though because it actually I especially dyed the yarn specifically for me, so I'm literally the only one in the world that has this particular shawl. So you guys have been asking to see more of my knitting. You seem to like it when I show it off. I saved it to the end of the video just because, you know, not everyone likes my knitting or even cares what my knitting looks like. But if you like my content and you want to support more of my work, there are a couple ways you can do that. First off, you can head over to drcarlin.com. My link is in the description below, and you can donate to support my content. Now, I know times are tight. If you don't have the money, if you're struggling financially, please don't give me money. Please don't. I really mean that. But if you do have the means and you want to do that, you can donate via PayPal for a one-time donation, or you can get perks through a monthly subscription on Subscribestar. Now, I'm very excited because we are basically 10% of the way to my monthly goal of $2,000 on Subscribestar. And what happens when I hit that goal? Well, I'm going to launch a podcast because you all have been saying, Carlin, you should do a podcast, do a podcast. Listen, man, I'm game, but podcasts take time and they take resources. So if you help me get up to that $2,000 a month goal, then I'm going to be able to justify it. There are all different levels that you can choose from, starting at $5. So it's really affordable for anyone to be able to buy into it. And it really does help me out. I appreciate every single person who subscribes or makes a donation via PayPal and Subscribestar. I can't thank you enough. You really, I'm really just very, very grateful and very appreciative.